Hello, my name is Kristin Kosyluk, and I'm an assistant professor in the Department of Mental Health Law and Policy in USF's College of Behavioral and Community Sciences. My research focuses on promoting recovery among people with behavioral health conditions, with the bulk of my work focusing on understanding the stigma surrounding behavioral health conditions and developing and evaluating programs meant to reduce stigma. I believe that it is critical that we think about the way that our mental health might be impacted by the COVID-19 pandemic and how stigma might function as a barrier to seeking behavioral health supports and a factor contributing to greater symptoms and poorer functioning. Research suggests that the stigma surrounding behavioral health conditions can lead to avoidance of behavioral health treatment, serve as a significant barrier to recovery, contribute to worsening symptoms, and result in experiences of discrimination. The Center for Disease Control has acknowledged that the COVID-19 pandemic has significant potential to contribute to the development of new mental health and substance use problems and the worsening of existing behavioral health conditions. It is more important now than ever before that we address stigma so that those who are struggling are comfortable reaching out for help, and so that the public does not endorse inaccurate and harmful stereotypes about people with behavioral health conditions, leading to discrimination. So what can we do about stigma during COVID? We can familiarize ourselves with programs meant to reduce stigma surrounding mental illness. One example of such a program is This Is My Brave. You can visit the This Is My Brave website at thisismybrave.org to view hundreds of stories of behavioral health challenges and recovery journeys, including how people with behavioral health conditions are able to overcome stigma and connect with the supports that they need. These stories are shared through creative means, such as monologue, poetry, and song, highlighting the immense talents possessed by people living with behavioral health conditions. I have served as the lead evaluator for This Is My Brave for the past 4.5 years. And we have found that This Is My Brave is effective for reducing stigma, improving beliefs that recovery is possible, and increasing intentions to seek treatment. If you or someone you know is struggling with their mental health, you can be an ally by familiarizing yourself with programs such as This Is My Brave, educating yourself about stigma and the inaccurate nature of stereotypes surrounding mental illness, and making yourself aware of mental health resources. Almost every college campus has a campus counseling center that has moved to providing virtual support services during COVID. If you search Counseling Center on your school's website, you can link to these supports. Additionally, many community-based behavioral health providers have implemented telehealth in order to continue to provide supports during this time of physical distancing. If you are not sure where to go to seek support, another great resource is the National Alliance on Mental Illness, or NAMI. The NAMI website is nami.org. By visiting the website, you can find information on how to contact your local NAMI affiliate. NAMI has a helpline that can be reached Monday through Friday, 10 a.m. to 6 p.m. Eastern Daylight Time. The NAMI helpline is a free nationwide peer support service, providing information, resources, referrals, and support to people living with a mental health condition, their family members and caregivers, mental health providers, and the public. You can reach the NAMI helpline by calling 1-800-950-NAMI or 1-800-950-6264 or emailing info@nami.org. It is also important that we are all familiar with the number for the National Suicide Prevention Lifeline, which is 1-800-273-8255. If you or someone you know is experiencing a mental health crisis or thinking of suicide, you can call this number 24 hours a day for support. Evidence supports the fact that people with behavioral health conditions can and do recover. Reaching out for support is the first step.